Well, each year, about 3 million Americans have their wisdom teeth removed. Typically, the patients are prescribed an opioid painkiller after the procedure. But one Cobb County oral surgeon has found a way to ease his younger patients' pain without pills. The Fox Medical Team's Beth Galvin explains why that's so important.
This is a tricky balance for surgeons because opioids can help patients manage their pain, but they're also highly addictive. And that's why Dr. Scott Rose's Cobb County practice is trying to find a way to reduce the number of prescription painkillers given to teens. And he thinks that he has found a way around the pills.
Take a quick look at you here, okay?
When 18-year-old Kelly Beck came to see Cobb County oral and maxillofacial surgeon Scott Rose 2 weeks ago to have her wisdom teeth removed, she was a little nervous about the pain.
So I was walking in kind of scared about how it would go, how the recovery would go.
And dental surgery is often the first time many teens and young adults are prescribed a painkiller known as an opioid. Experts say the vast majority will take the medication as directed with no issues. But because the teenage brain is still developing, the idea of introducing a potentially addictive medication for post-surgical pain makes Dr. Rose uneasy. So he offered Beck and her mom an alternative way to treat her pain.
We just wanted to do it. It seemed like a better option. I wouldn't have to take any hardcore pain medications.
Instead of sending Beck home with a prescription for pain pills, Dr. Rose used a long-lasting local anesthetic known as Exparel during her dental procedure.
So the medication is delivered at or around a surgical site, and it keeps the area numb and pain-free for the first 3 days after surgery.
Dr. Rose says about 90% of his parents of his teen patients are choosing this pain treatment over the pills, even though some of them have to pay an additional $300 for it.
It tells us how important this opioid problem has become and how cognizant the patients and the parents are.
And this is an issue deeply personal to Dr. Rose.
One of the big events that has, I guess, stemmed this is the loss of my younger brother, who passed away from an opioid addiction in 2006. I probably don't go a day without thinking about him and his circumstances.
A few days after Kelly Beck's surgery,
it was not bad at all.
The pain she expected never came. A recent study found that surgery can open the door for longer-term use of opioids in teenagers. Researchers looked at common surgery procedure patients between the ages of 13 and 21, and they found that about 5% of them were still trying to get their painkiller prescriptions refilled 3 to 6 months after their surgery. And the longer you use these opioid medications, the harder it is to stop using them. For the Fox Medical Team, I'm Beth Galvin.